Thank you, Ranika. And thank you for the invite to come and speak to you today about our cost calculator. As I've been sat here this afternoon, and I'm going to look over it in Harriet's direction now, because Harriet has worked with me for the last 15 years, and I've realised that today is the date that it was actually 15 years ago that I started at Loughborough University, and so I have spent the last 15 years of my life doing this research. And I think, just as Judith has said, as the research has evolved and developed, we have come up with more and more questions. So as we move forward with answers, it also raises more and more questions. I'm also going to speak to you for about 25 minutes. So I'm going to condense 15 years into 25 minutes. So I'm guessing that many of you in this room are going to come away with more questions than maybe I give you the answers to. There are a number of publications associated with our research, so please do have a read if you want to know more, or do contact myself or one of the team. So in terms of starting off today, I want to outline some of the basic principles of what we've been doing and also our approach. And quite often when I've said over the last 15 years that I'm doing work on costs, people always think it's about the money. And actually what we have been doing is looking at costs in terms of the relationship of costs and services, interventions in relation to children's needs and the outcomes that are achieved. And by needs, I'm talking about the needs that the child is presenting as they come into contact with children's social care, and also taking into consideration their prior experiences and circumstances. And by outcomes, we're talking very much about welfare outcomes, and I'll come on to outcomes in a little bit more detail, particularly around the data that we have and outcome measures that we use. We also, in terms of our approach, it's about starting from the bottom up. So I think, this afternoon has been planned perfectly, because Judith has just been talking about their work and using the child as the unit of analysis, and we are exactly the same. Our starting point is the child, it's the case, it's not the total budget. And I know for directors in the room, you have to look at total budgets, and you'll need to know how many children are accessing a service. But what we have to do is go through a process of reconciliation between the total budget for a part of the service or a whole service, and then building up the costs from the bottom and coming up with a figure that's actually close enough to give some credence to what we're doing. What we've also been doing is using routinely collected child level data. So again, as Judith has been talking very much about the CAFCAS data, we have been using local authority looked after children data that is returned to the Department for Education, also looking at children in need data as part of the Children in Need census, but also a wider piece of work looking at all of that rich information that sits within local authority management information systems and how that can be extracted to be incorporated with the other data. So in terms of what we've been doing is we have been estimating, calculating unit costs for different parts of the system, but also looking at the costs of care packages. And the emphasis is very much on a longitudinal approach. So one of our existing studies that we're right in the middle of at the moment, we're looking at data for a cohort of looked after children over 6 years. So we're looking at what happens to them, the different patterns, looking at placements, different services, and what happens over that 6-year period. In order for us to carry out any of our cost effectiveness analysis, we have to have something to compare it with. And in terms of comparing it, we're talking about the inputs, so what are the different types of services, comparing one service with another, one intervention with another, also looking at different levels of support. Isn't necessarily just a service, unless you're considering the child having their social worker a service, or is that ongoing support, but it's actually looking at all of those different elements. And then the comparisons at the other end are outcomes. What are the outcomes that you want to achieve? And what are the different types of outcomes that have been achieved? Obviously, when we're using this amount of data and we're trying to build up a model and an approach based on some averages when we're talking about unit costs, but also real data in terms of the individual child level, we do have to make some assumptions. And what we're always trying to do is about increasing transparency. It's very much about being clear about what is included, what's not included. And for the purposes of discussion today, what I'm focusing on is our work which has looked at the costs to children's social care. We have some studies at the moment where we are looking very much at joining data sets across different agencies and how that can be combined so that we can start to get a clearer picture of the costs to a whole range of agencies, but also the outcomes. So, for example, looking at police data, youth offending data, child and adolescent mental health data, as well as children's social care. And we're building all of that up from an individual child level. So that's some of the work we're doing at the moment. By looking at the different pathways to permanence, the pathways through the system, we can then look at some of the potential costs avoided. So one of the key conceptual underpinnings of what we have been doing is to separate, as I've already mentioned, services and support. So by services, we're talking very much about, for those children who are in care, their placement, and then looking at any other services that are provided either by children's social care or other agencies. We also do a full breakdown and look at the case management activity. That allows us to look at the level of social worker involvement in cases and to look at how that changes according to the child's needs for different placement types. An example that we often use is the level of activity around placement change. And we know those children where a new placement is needed, there will be a flurry of activity. It's capturing that activity, the cost implications of that, and also the difference for those children where it's finding a first subsequent placement, or if it's finding a 20th, 30th subsequent placement for some of those older young people, where that level of activity to find a placement for them is hugely time consuming, not only for the child social worker, but generally for the whole team and for others in the local authority. It's capturing that level of activity and the cost implications of that. When we first started out, many years ago, the reason for being commissioned to do the first piece of work was because the Treasury had concerns about, at that point in time, the numbers of looked after children were going down, but expenditure on looked after children was going up. And there was huge variation between local authorities in their unit costs. And what we have been saying is, it's fine if the costs vary, so long as you can explain it. And so what we've been doing is looking for explanations as to why there are variations in costs. So what we have been doing is developing a standardised framework, which is actually looking at a whole series of processes across the looked after children system, children in need, child protection. We've also done some work around the common assessment framework, short breaks for disabled children, and some specialist interventions as well. So what we do is we do a breakdown of what happens for a case from the point of entry, point of referral, to case closure. What happens, what are all of the activities, what are all of the tasks, and who is involved. And essentially our standardised framework, the activities come under these overarching core headings in terms of decision making, assessment, care planning, the ongoing support. If the case is open, someone will have responsibility for it and there will be their ongoing activity. But also the activity for referrals to other agencies and other services. What we have found with the development of our standardised framework is that it has been replicable across every local authority that we have worked with across England. We've also recently found that it is replicable across Scotland and also the US. So it's something that we're finding that the framework is working as we try to replicate it in different local authorities, in different countries, but also for different parts of services. So in terms of going back to my previous slide, the bit around the case management activity is how on earth do we know what people are doing? So this is how we found out. So over the years, we've been doing a whole series of focus groups. I just want to go, oh, Dave's left, but I was just going to say, when Dave was saying earlier about lead members and going off to visit teams with cakes, and I have to say, we've tried to go and visit them with cakes or with fruit, and cakes are generally much more well received, I have to say. So within those focus groups, we use the focus groups to make a distinction not only between case-related and non-case-related activities. We're not trying to find out how workers spend every moment. What we're trying to do is to understand how much time they are spending on certain types of cases. It's also allowed us to do an analysis of direct and indirect working time. So we can start to understand for certain parts of their work, are they spending a higher proportion of time with children and families? Are they spending lots of time working at their desk? And over the years, we've also sort of, going back a few years, we were working with a number of local authorities doing that method as they were introducing new management information systems, and made for some quite interesting focus groups in terms of what workers were feeding back to us. That's also allowed us to identify a standard case and variations. We start to understand there the amount of time that is spent on all of these different activities. It also allows us to understand the context within which children's social care workers are working. We've then followed that up with a whole series of online surveys. So it means that we have social workers, administrators, independent reviewing officers, social work managers completing time use surveys. And we're not asking them to complete it for all of their work. We ask them to complete those surveys for a specific case. So it's the amount of time spent on a specific case. And we have, over the years as well, also had some social workers who have completed event records, again, just for one case, but for up to 3 months, so that we can see all of the activity that they have carried out on a specific case for up to 3 months. So I'm not going to get too much into the technical detail today, but I did just want to show you this diagram, which I'm not entirely sure how clear that's going to be on screen. But essentially what we have developed is a piece of software which takes in all of the various pieces of data and then provides a whole series of outputs. So over here we have our inputs. So we've got the time use activity data, so all of that time use activity data by all of the different children's social care personnel. That is all organised by a whole series of processes that are carried out across the different parts of the system. We then have the salary data for each of the different types of personnel involved. We've also done, in partnership with colleagues at the University of Bristol, some work looking at the organisational overheads of local authorities and the costs of those. So essentially those 3 pieces of information there become a series of unit costs for our different processes. And here I'm just using an example of looked after children. That data is combined with child level data. So we will use the child level data. So for those of you that are familiar, each local authority has to submit on the 30th of June every year their SSDA 903 data, which essentially is the data set on all looked after children, which will have basic information about the children, their placements. And what we can do with that is where we work with some local authorities, if they have additional data, particularly around outcomes, if we can match it according to the child's ID, then we can bring in data from multiple sources. And then we also have the finance data that goes in there as well. So any information about placement fees or allowances. So that's all of our inputs. And in terms of the outputs, and I'm going to go to my next slide because it'll be easier to read, is it allows us to do an analysis at the individual child level. So we can look at the costs and how they build up longitudinally at the individual child level. And what we have found is they're particularly helpful for illustrative case studies, but actually when you're getting the larger data sets, it's more helpful to look at groups of children or whole populations. So we could look at a whole population, for example, of looked after children. You could look at that analysis over time. So if there's a new intervention that's focused on improving placement stability, you could then look at the whole looked after population and levels of placement stability over time. You can also look by need and by outcome. The cost calculator as a tool also includes a what-if analysis, so it allows you to change the placement type of certain types of groups of children. So you could change from looking at, say for example, children who are placed in residential care. If you wanted to introduce a specialist fostering intervention to meet the needs of a specific cohort of children, young people, you could do a what-if analysis to look at what would be the changes in the costs associated with that. So in terms of the focus of today and pathways to permanence, is what we have done to date is we've looked at some of those different pathways and the cost trajectories of those. So coming back to some of the earlier points that John raised and Ian Sinclair's research is looking very much at drift, what those pathways look like. We also found in the first piece of research that we carried out when I started at Loughborough University, it was the adolescent entrants who were particularly costly and the outcomes were poorest. We've done some work now looking at the different costs associated with different types of foster care. We've also recently done a series of studies looking at return home from care, looking at the costs associated with those, and we can do an analysis in our cost calculator looking at those children who oscillate in and out of care. So you can actually start to see those patterns of children who they may go home for 30 days and then they're back in care for 10 days and then they may go back home. We know what that means in terms of outcomes, lack of stability. We actually start to build up that cost picture and seeing that incrementally more expensive care pathway as they re-enter care. I'm going to come on to adoption because that's one of our next steps, working in partnership with Coram. And so fascinated to hear what Judith was saying about special guardianship, because we know some of the costs associated with special guardianship orders. What we don't know is the unit costs, and taking our approach across to special guardianship at the individual child level. We know from Jim Wade's work about different levels of financial support from local authorities, about different levels of support following the order, but we don't know enough about the costs associated with those, and it would be wonderful to have the opportunity to then link that to outcomes data. So having said that our individual child level data, it can give us illustrative case studies, but actually the real value is in the aggregate data. I did just want to show you two different cases here, because you start to see very clearly the different pathways and the different costs associated with these. And these are two children from my colleagues Professor Harriet Ward and Becky Brown's longitudinal study of children who identified significant harm before their first birthday. And you can see here, so this is just very basic, we're not showing any of the decisions or the outcomes, but what we're actually showing is the costs, and you can see how the costs are very different. And for Madeline at this point, so they were both, there was legal orders sort of pre-birth, they came into care, Madeline returned home, and there were low levels of involvement from age 1 through to about 5.5, where the case was open as a child in need for a little bit. There was a child protection plan for a little while, then the case was closed. So between the age of 1 and sort of 5.5, just a small rise in the costs associated with that case. Whereas you can see here with James, there's a peak of costs here. Does anyone want to take a guess as to what happened to James? There we go. So James was adopted, and then we saw this very sort of steady line here as James was adopted. What we've seen with Madeline is at about age 5.5, her needs had become much more pronounced. She re-entered care. This journey has not been the easiest. Placement changes, and we're now following Madeline and James at age 8. So the next step for Becky and I is to look at those as to what's happening. Is James's adoption still stable, or are there problems? I can see Harriet shaking her head, and I know the same, is that no, it's not, it's facing difficulties. So actually we are going to see a change in James's costs, and they're going to escalate. But it just starts to show how there's the different journeys through and the different costs associated with those. So in terms of permanence, we know that if it's get it right, improved outcomes, there's potential costs avoided. But actually in terms of getting it wrong, Instability, we know in terms of the evidence about impact on outcomes, but it's really starting to understand some of the costs associated with that, as well as the outcomes. So I've already mentioned, we know that placement finding becomes incrementally more expensive the more placement changes that children experience. And we've also seen higher levels of social worker activity during the early stages of new placements. So if you've got a young person who is moving from placement to placement to placement, you have a social worker who is working at higher levels of activity continually as this young person is moving. And as I've already talked about, those children and young people who are oscillating in and out of care and the costs associated with that. So just to finish off, is just to very briefly mention the work that we are doing in collaboration with Coram. We have funding under the Department for Education Innovation Programme project, and the idea is for us to develop and extend our cost calculator model for adoption. And some of you will, I'm sure, remember the work that Professor Julie Selwyn did around about the time as we were starting off, when she was looking at the costs of non-infant adoption and developed the series of processes. So we're going to be building on those rather than starting all over again. And what we're doing as part of that work is mapping out the case management and support activities for adoption, looking at variations in adoption, and then, as we have done for our previous studies, calculating the unit costs for those different processes, and extending our cost calculator tool, looking at the child level data, which we're going to take us on very well to Kevin's presentation, which will follow mine, and to test the functionality of the tool within local authorities, and we're due to complete in March next year. So if you do want more information, please do feel free to contact myself or my colleagues. We do have a summary report of all of our research projects associated with this on the website, and also a summary of all of the different publications associated with it too.